day, Dr. Praveen. Here we have today with us Dr. Praveen Kumar Saxena, who is an integrated physician from Hyderabad. He's got many years of experience doing a lot of things. So here we would like to hear from him directly. Good day, sir. Good day to
Thank
you.
you. Thank you, Karthik. Thanks for the wonderful this one. Uh, it's a wonderful kind of thing, but many years of experience means what happens is that we start believing we started getting veterans or old.
Okay.
I still have a lot of years.
I agree with you.
Yeah.
So, sir, can you tell us how? I know you're a radiologist by profession, and you started your career in radiology. So, how did you end up in this space?
Before that, I'll just let you know one thing. When I completed my medicine,
Mhm.
MBBS, that 5 years and all that, I was before joining the any specialty. Everyone used to tell that, "Ki, I want to join. I want to become a cardiologist. I want to become this one." So, but the thing is, I started wondering the way the patients have been treated. Particularly, I was worried about. I used to. I had done some ICU postings and all that, and I saw there's such a big challenge working in a ICU hospital in a ICU. There we see lot of sudden mortalities. The patient you see today, by evening he goes up. So I was really disenchanted. I felt ki what are we doing with these people? I'm really not happy the way people are getting treated or something like that. Then I realized, no, Baba, I want to do something, and I don't want to see. It is very taxing for a medical doctor what that 5 years teach you, and it is like it's a very stressful job, and you start working totally, and you see your relatives, your dad and all that having that particular thing. So I made it my mind, okay, I need to do, I cannot spend all my time on that particular thing. Probably I'll take a 9 to 5 job. I have two options. One was radiology, another was anesthesia.
Right.
Yeah.
That's
So
how
I
I
have
ended up in radiology.
yeah, I jumped to radiology thinking that it is a 9 to 5 job, and I can complete that, and after that,
Right.
hands off.
Right.
So, but destiny is destiny.
Yes.
Now, so the cases which I used to dread, cardiac cases, cancer cases, all of them they are coming to us in a kind of leftover cases we get.
Yes.
They are going through chemo, they are going through radiation. After that, they come to us for hyperbaric oxygen. So something is maybe it is written in your. It's a divine will, and as a doctor, really you need to accept challenges and all that. At the same time, I can always tell you, radiology gave me the background. I don't spend a lot of time on the patient. Just a cursory examination while doing it with the probe, thyroid, cardiac, liver, everything. This is beauty of a integrative medicine is. See, if you have a heart problem and you're looking at your liver and you're looking at the colon issues, at the thyroid issue, usually what we were told when we did our medicine and all that, okay, thyroid goes to the next doctor,
Yes.
cardiac goes to the other doctor, liver goes to the
So
hepatologist.
they compartmentalize diseases into specialists,
And
doctors.
there is no
interconnection.
communication between them.
Absolutely.
So that is a reason why you need to have a holistic approach. Unless you treat the fatty liver, fatty liver is so common. As a radiologist, I must have diagnosed so many. Karthik, I have done a lot of ultrasound diagnosis of fatty liver. Then we used to see what is this happening, and patient is fine. He's a diabetic. He has some issues with the triglyceride and all that. But we followed up for 5 years plus, and all of them started having got into something like blocks. So that I felt is a missing link. And the other thing interesting was the patients which we picked a fatty liver, maybe 40-year-old guy, 40 years. The next 5 years down the lane, he started developing into diabetic. So
So it's
this
actually
chronic disease,
it's a
it's a
sign.
pre-diabetic.
It's a sign of insulin resistance,
Ex-
which even comes before pre-diabetes.
Exactly. So what happens is that I started doing something like camps on the side. Not that camp basically, but I used to tell that okay, this guy is going to get into diabetes.
So this
So
is the importance of
personalized
doing
personalized
personalized medicine and doing
regular checks.
so that you can prevent the prevention of chronic diseases.
See, my focus was why the person, there is you have a normal thing here and you have a diabetic, and in between, suppose I give you an example, there are five people here, one person is diabetic, and everyone says, okay, four people are not diabetic. It's not like that.
Yes.
One person is non-diabetic, one person is diabetic, the rest in the three middle one, they are into pre-diabetes zone.
Yes.
They are waiting in the line queue
To get into that zone.
to get into zone. And if you have something, pick up that segment and tell that you are not going into that side. Start doing all your interventions there. Because once they become diabetic, it is difficult for them to cut back.
Reversal is the
Kind of thing.
tough.
So you can use your markers, ultrasound wise, blood markers are there and all that. Now that it's good actually. In our time, it was not much. HbA1c was not there, Karthik. I'm talking about 15, 20 years back. So we used to depend on that this particular thing.
Yes.
Ultrasound.
Now we have HbA1c, we have continuous glucose monitoring, ambulatory glucose monitoring, we have those sensors which people put on. So the modalities have increased, and so has the ability for us to identify the people in the segment, so which are the pre-diabetic segment or any chronic disease which we can actually pick them up and we can treat them and offer.
This is why we are talking about to the public as a whole. Ki don't try to see you're where exactly. See, before embarking any journey, you need to know where are you.
Exactly.
So which part you are there? You're into this Asia or kind of thing. Then you start working on that. So if they know that they are pre-diabetic, if they know that they have got subclinical hypothyroidism, these are the people who fares very bad. Sudden they'll have some events and all that.
Because by the time they manifest, it is too late.
By the time they don't get into hypothyroidism, overt hypothyroidism, subclinical hypothyroidism, they have that constant LDL fractions and all.
So they have a constipation, they have dyslipidemia.
They test the thyroid, TSH normal, T3 deferred normal. So, but subclinical hypothyroidism, it's more of a clinical diagnosis.
Yes.
And unless you do something like free T3 and all that, you can pick up. But for a general public who is normally walking, who is regular exercising, and he's putting on weight, he's putting on cholesterol, then you need to think something is some hormone is not working. Yes. Either is thyroid, you have got some other things also you need to work it out. But I think the younger generation knows a lot now.
Yes.
This because of the social media and podcast, what you are doing, people have become more aware, Karthik.
Thank you. So, Doctor, I want to ask you one thing. I know you've done a lot of work on autism. We do see a lot of children who are autistic, and also we see the increase in incidence of this particular one over the last many years.
Yeah, it is a kind of, I think it's a concern. There's an area of concern because one thing is the pediatric care has improved. Everything has improved. In spite of that, it's not just autism. There are 4 segments which are coming here. Out of 100 kids, when you take, you have got 10 kids will get some allergies, and 10 kids have allergies. 5 kids will have something like asthma. I'm talking about 5%, 10%, as well as 3% or 2% is ADHD. Now, autism, they say, is 1 in 30 in India.
Right.
The 1 in 30 is the incidence. 1 in 30 kids are autistic. So the kind of thing is worrisome actually. Why all these problems are allergy, asthma, ADHD and autism. These are the 4 A's which are constantly be going up. There are a lot of factors which people have to start looking into that, and it's a now what happens is we can't pinpoint to only one particular things and all that, but we have evolved. Now we need to see that we can't give our cell phones to the 1-year-old.
Yes.
We had to. I know most of the parents and all that. They are so happy. They are telling Doctor, Saab, my son is so he's doing so good. YouTube, he's picking up everything. So that area, that age, it's not preferable.
So
What I,
that
they,
is the EMF from the radiation
EMF,
is one
that's coming
big
to
thing. I
exactly.
think a lot of these things start with the social fabric itself. Women getting married at a later age and having hormonal imbalances and having poor diet and nutrition. Although they have the means, but they're not actually having the right diet and nutrition.
But I think the generation is smart enough. They are following all the things now. They know what are the things and all that. But still, as you rightly said, there are factors which can increase the number. This particular thing, just vitamin D deficiency. Now, I can tell you before 15 years before we started doing some tests and all that,
Yes.
and we were the lone people. I had to pick up three anesthesia, two radiologists as a control, and to case as well as a control, we picked up a laborer worker who is working on the sunlight.
Sunlight, yes.
With the shirt off. He was working as a laborer.
Yes.
So we could see a stark comparison between these two anesthetists and three radiologists. Their values of vitamin D 15 years back, Karthik was less than 10.
Okay.
And the other people who are manual laborers, they didn't get diabetes, they didn't get hypertension, and they had a peaceful sleep, right? And they used to sweat in the scorching sunlight. Their vitamin D was more than 60.
Fantastic.
This is what we picked up 15 years back. So now still that phenomena is working.
Yes.
Somewhere.
I think we see vitamin D deficiency as an endemic problem. It's present in most of the people, and vitamin D receptor resistance is also
It's a very big issue. Very big issue.
Problem.
Something we doctors have to understand now. Okay, this is vitamin D resistance. Why it's coming? Is it because of the lead or glyphosate or something like that? But public has to work on having extra vitamin D during pregnancy.
Yes.
They need to have a proper sleep during pregnancy.
Yes.
They have to. I can always tell you what are the big things which are elephant in the room, which is not seen. One is the white light.
Yes.
The light which you use in the computer or your cell phone, it's a LED light. Every light is LED now. So what happens here is it doesn't have. There is a IR spectrum for infrared spectrum. So all the LED lights are into that UV and less zones, ultraviolet, and the normal red. This one, the see VIBGR, the light range is like that. V is violet. From there it goes last to the red.
Yes.
So above the red is infrared, and below this is ultraviolet.
Yeah.
So all this light is in to the violet and all that. Blue light. It contains a lot of blue light.
Okay.
VIB.
Yeah.
B is the blue light. Blue light, what happens is that it can screw your happiness. If you're exposed to blue light in the night, and I have a lot of geriatric patients with me. Now nobody uses clocks and all that. That radium lights.
Oh yes, it's all gone.
Everyone checks the phone.
Phone, yes, for that.
And that stupid phone, the light, you have a intrinsic biological clock, which is a very excellent clock.
That's right.
Right? Diurnal rhythm, it tries to maintain that. And the moment that sees the light, your photons, it gets into that. It thinks it's morning.
Morning, okay.
And shuts down the release of melatonin. There is what happens is melatonin is formed during the sunlight and it is released during the darkness. Now with the cultures what we have done, or most of the people who are going for softwares and all that, they follow some light at night phenomena is happening.
Yes.
All the lights are being it's like eliminated. In that condition, you cannot switch off properly. And if you cannot switch off, if you are doing that kind of work for more than 2 to 3 years, you are in for problems, boss.
Yes.
You are in for all autoimmune problems. You are what I'm trying to put across is your resistance power doesn't develop.
Goes off.
It
Exactly.
goes up. Why our elders and all that they were good having good thing is, I think the best advice my parents gave us was the only one thing here.
Early to bed, early to rise.
Right. No, no, that was the best advice. They said no smoking. That is also the best one. No alcohol. But the best one was the to fix the time to sleep. And I think I still try to work it out. 10:30 or 11 o'clock, whatever. I try to switch off the lights totally. Even the AC light should not be on.
Yes.
So that gives you a proper peaceful sleep, and you can always do some more things and all that. And the people, how many insomnia cases? Yeah,
Yes.
as a doctor, we are fed up by looking at number of cases.
Yes,
People are hooked on
the
tablets and-
benzodiazepines and a
Yeah,
lot
yeah,
of things which are in there.
So that is the number one reason for ill health, according to whatever. And there are, of course, all the we have toxins in the food, air, and water. And as today he was telling, actually, there's a kind of which Dr. Levy was talking about. Such a beautiful kind of synopsis he has put across. So I put a small thing. I tell my patients, you came with the DISEASC. My job is to remove the DIS and make you at ease.
Okay.
But it is a long process.
Yes.
There is a no T20 match here.
Okay.
It has to be 5-day match.
Exactly.
You have to change your diet. You have to change your habits. You are trying to work on so many this one.
So when you start doing your detox protocols and things, you give them say about what 3 to 6 months for them to sort of improve in all.
Again, everyone is in a kind of thing. Every patient has got some areas and all that. But I try to make it sure that they understand the process well. If they have not, suppose most of the, what is the common thing? All diabetics, all hypertensives, everyone with this thing, they have underlying constipation. So unless you clear that, don't take up the other stuff.
Yes.
We do something like photobiomodulation. I was talking to the other day about you, this particular thing. Fantastic thing. When the thing is, when you look into the previous history, in the sense, people who were fire, the light was not there. They used to burn the fire, and they were quite healthy because they used to get the lot of infrared and far infrared, near infrared kind of things and all that. As Edison invented the light, but I can still tell you that bulb, which is incandescent bulb, it's much better. And I, especially my piece of advice for people who are having autism, kids, or who are dealing with the health issues, not controlled diabetes, not controlled this one, and they are doing everything. So look into the small things also. And it makes a difference.
And photobiomodulation we can use in children as well as in adults.
It's a very simple thing.
Okay.
You're just allowing them to sit into that particular stuff, and by that you can always do some detox, meaningful detox. Yes, it has to be followed up. You need to see that your intestines are always. You need to give some flaxseed, or you try to give some use of gold, psyllium husk, and all that. So these are the things now everyone is talking in the YouTube also.
Yes.
So
and when you enhance this photobiomodulation, you make it into photodynamic therapy.
Yes.
Do you use things like methylene blue and other things?
Exactly. I think that is the only thing for the people who are having a severe issues and all that.
Okay.
And that's a very successful thing which is happening.
Okay.
And I'm happy with there is one more guy who has come from Europe. He's also talking about that.
Yes.
So, yeah, methylene blue. It's a good thing. And exactly, this is why I'm trying. I'm like so much excited. Is this integrative medicine was only looking at all these possibilities.
Exactly.
What happens is that if I'm a conventional doctor only, and whatever is written in the 60-year-old books, if I follow the same kind of thing, I'm not getting that kind of
It's not
results.
relevant anymore what we studied at medical school. Things have changed. The
Maybe the basics are good.
Of course,
basics are good, but the way the diseases are coming without any
even
warning.
the incidence and prevalence of disease has changed a lot since we actually cardiac illness was never mentioned below the age of 60 before. But whereas we see cardiac illnesses right from the word go, especially things have changed a lot post pandemic.
Exactly. This is
So
also
what
is a
what
real concern
yeah
actually.
what actually concerns you post pandemic or post COVID? We have seen a lot of changes in health.
Thing is, we were very happy and in the sense, but COVID gave us a very good jerk actually. We thought ki everything we have achieved as doctors, we have know everything and all that. But the kind of COVID 2 years, 3 years, whatever has happened, and it has changed the whole paradigm here. Or things are not that easy now. The people who have gone into the people, someone had COVID, long COVID, and after that, his immune system is so disbalanced. Whatever you do, it's not getting corrected. I can give scores of examples, and for that, we started documenting. So, like somebody coming with a autoimmune problem, and we saw this guy was in pink of this health before 2020, 21 or 22. After that, suddenly this whole things changes. So what? See, you need to become an epidemiologist also.
There's a lot of data coming in post vaccination. People's immune system levels have changed a lot, in terms of spike protein and the people who have and the data. What now it suggests is the people who actually naturally acquired the infection without having the vaccines, they have got a longer lasting effect for the COVID antibodies as opposed to people who had the vaccines.
100%.
The severity of the illness is also.
No, Karthik, you are always right. This is what was the study, and Delhi there was a school study was done during the before giving the when the see all the vaccines started for the frontline workers, the people in army, people doctors and all that they were given the first, and when they were contemplating to give the kids to the last this one, by the time there was a study in Delhi which came out, and they said 90% of the kids have antibodies
Already, because they had a subclinical
natural
infection.
they had a natural infection.
Yes.
And I can tell you they were the healthiest guys. So somewhere there is a kind of there was a mutation or something which was going against that particular thing, that mRNA technology vaccine, which was supposed to be injected into the deltoid, was meant to be in deltoid for long term. So what happened was it was LNP. There was a kind of lipo kind of thing was done, and with that, it was said that it will be here, and any time new things comes, he will recognize, and they will start producing antibodies. But it didn't happen that way. When it was given in deltoid muscle, from there, all the spike proteins and all that, they started moving into the to Robert Malone has developed this technology,
Yes.
mRNA technology.
That's right.
So Robert Malone has done something called, he has used a lipid nanoparticle to envelop that virus so that it gets into the system thoroughly. So once it is given here,
it goes everywhere.
It started going to the spleen, ovaries, brain. It crosses the blood-brain barrier, and along with that, there was something like adjuvants were there. Adjuvants were nano aluminum was there.
Yes.
There was something like lot of there were other adjuvants also was there, but nano aluminum takes a special mention here because it's one of the neurotoxin.
Okay.
And we are now seeing a number of cases who has Parkinsonism because of this particular.
And a very large number of neurodegenerative defects we are seeing in younger population.
Exactly.
As young as my youngest patient is 29 years of age.
Yes. They have started with tremors. I have a 27-year-old girl. She started having tremors. And the reason we are not able to, they had taken two vaccines. After that, they were taken, boosters were done twice. and it's a kind of it needs to be properly looked, because we have all the statistics. Worked with something called UHO, which is a Universal
Yes.
Health Organization, and we were the founder members of that. And we have gone to the entire kind of thing. We have epidemiologists, two epidemiologists, one from All India Institute, as well as there is a one Amitabh Banerjee from
DY Patil.
DY Patil,
Hmm.
and they had shown us such a wonderful work. The vaccines which were given in the countries,
Mhm.
and there is a lot of issues with that.
Mhm.
So there's a clear cut distinction. The people who had not taken vaccines
Hmm.
had a smooth ride. So
Yes.
it's
No,
it's kind of thing.
that's my clinical experience.
But
And
I can
as well.
tell everyone, if you have taken one and two,
Hmm.
stop at that
Yes.
level. Don't go for the further ones. And before taking a vaccine, also is a medical procedure.
Hmm.
You need the informed consent.
Hmm.
You have to work it out. And I can one more thing I want to add.
Hmm.
They need, before going for any vaccination or any other program,
Hmm.
they need to meet integrated doctors like Karthik and other doctors,
Hmm.
so that you can put them on something like melatonin and vitamin C
Mhm.
1 week before the vaccine.
So there are actually things what you can take before the vaccination to mitigate the effects,
Exactly.
mitigate the side effects of the
Side
vaccine,
effects of
but
vaccine.
still get the beneficial effects out
Exactly, that can be done. See, we are not trying to tell that everything is fast and all
of it.
that, but we need to go in a proper way. The
Mhm.
people, it's not written here the immune system is problem.
Mhm.
So, Karthik, you can just understand. It was in Alexander Fleming. He took
Yes.
penicillin.
Yes.
That was told as a wonder drug.
Hmm.
Thousands of cases were saved and all
Hmm.
that. It's a fantastic thing. But over a period of, after some years, people found there were some deaths were happening.
Hmm.
So doctors, there are very few doctors who started telling them there is some deaths.
Hmm.
So they were told, no, no, this is wrong. The same thing is happening here.
Exactly.
Then what happened was, it was true.
Anaphylaxis to the
Anaphylaxis,
yes.
suddenly kind of things.
Hmm.
And then there was a formulation.
Hmm.
They said, we will test the test dose of penicillin. If it is okay, then we will give.
Hmm.
That sort of thing is not there in this particular thing
And
scenario.
it has to happen, and it will take time. These regulations to come will take time, and awareness has to be
we
there.
are giving for one and all the same vaccine.
Yes.
That's a problem.
Hmm.
A premature kid
Hmm.
less than 1.2 kgs get the same vaccines as a 3 kgs.
Yes.
So there is a problem there. So the kind of, he doesn't have that particular thing.
Ability
He
to-
cannot metabolize things and all that, and it goes for a toss. So this is what is integrative medicine all about.
So post vaccine, what are you feeling that the potential problems the population could face going forward?
Exactly. The kind of thing is, what has been happened here is, we started looking only for the acute effects.
Hmm.
We gave a vaccine and we observed the patient for 30 minutes, and they said, okay, you get out, everything is fine. So people were told, anything happens tomorrow, next day morning, you let us know. After that, we forget what happened with that. The problem of vaccines starts only after 3 months, 6 months, 3 years also. These are all called delayed hypersensitivity
So
reactions.
what are the things people should watch out for and inform their doctor if they
Exactly. As now we are so careful. Everyone looks at your own vitamin D. Everyone, even if I, as a doctor, don't prescribe, some person goes, I'll get my cholesterol test done and comes to me. Right? Like that, you need to check out for a simple test called complete blood picture, CBC. Right? In that, you need to look at something called lymphocytes, monocytes, what are they? And your doctor can decide about that. Right? Along with that, they can check your HSCRP. It doesn't cost more than 250 rupees, something like that. But everything has to be personalized. The person who has got some chronic disease, let's say he has got some heart disease, or he has got some diabetes, or he has some autoimmune disease, and he has just taken this particular, he has to keep following all these things. At least 6 months, once in his 3 months, something like that. A D-dimer test, small test,
That's right.
it can prevent a lot of unnecessary deaths.
Yes.
It's really frightening to see sudden deaths and all
Yes.
that.
In
And
young
as doctors,
population.
and as doctors, we are not able to pick up.
Hmm.
What happens is that by the time things, but the awareness of people.
Yes.
I see very aware people
Yeah.
now.
More and more people.
They are getting B12 test.
Mm-hmm.
We don't write B12. They said, "Get oh my B12 is this much." So I want that kind of awareness to come into the population. They should be agile, because no one is going to ask you this problems like autoimmune problems. If there is some problem in the lymphocytes, we will know ki he is going to land into autoimmune issues. The higher D dimer, we know he is going to land into either cardiac or CVAs.
Yes.
So this is the way medicine has to be practiced. It's a tough thing to be a doctor these days. Yeah.
This is the future. The future is the futuristic medicine is integrative medicine or regenerative medicine or
You can call personalized medicine, whatever is it, but
yeah.
it has to be like given a proper perspective. Somewhere you can't just go like that. Okay, you get that blanket of 12 tests. LIC asks
Yes.
12 tests. Doesn't come out anything. You
Exactly.
do a ECG. The next half an hour later, you get into a problem.
Exactly.
So this is it's you have to be proactive. Look at something, homocysteine check.
Yes.
So many things has to be done.
Yes.
But I'm really happy Chennai doctors are doing so well.
Yes. Thank you so much, Dr. Praveen Saxena. You've been wonderful as usual and enlightened with so many facts. Thank you very much.
Thanks, Karthik. It's a pleasure being here, and always look forward to Chennai visit.
Thank you.
Thank you.